I'm sitting down today here with Delegate Dr. Dan Morhaim out of District 12. 11, did it again. District 11 in Baltimore County. And he is sitting down with us today as the real architect of the Harm Reduction Conference. Now, this was your brainchild, they tell me, and tell me about how you came up with the idea and what you hope to achieve with the meeting.
Well, the idea really came out of my years of clinical experience as an emergency medicine physician. I've been in the legislature 21 years, but I've been an ER doctor for about 30 plus years. And so much of what I was seeing in the emergency room was social problems, and the largest number of social problems were driven by the war on drugs and the addiction issues. And it just seemed that there were some really better ways, cost-effective ways, not only to reduce healthcare costs and reduce the crime and the trauma, but to improve people's lives. And what we were doing, the war on drugs, which has really become a war on people, clearly was not working. After all these years, we're no better off and far worse off than we were when we started. So it got me thinking for quite a long time now, what it's a different way. Been on the faculty here at the Hopkins School of Public Health and got a very positive reception from all the leadership. Hopkins really is trying to focus in on Maryland and Baltimore City, and this is a driving source of violence, of domestic tranquility, of all kinds of problems, and that's how this came up. And fortunately, a broad section of folks from across the community, academic, public community, are participating. So I'm very excited, and we'll see where it comes out.
So you mentioned both your work as a delegate and as a clinician. Can you tell me about how that work's connected with the issues of addiction treatment and drug policy, and how did you first get involved in those issues?
What it really boiled down to is this. I didn't feel I was able to complete my role as a physician. Many patients come to the emergency room with addiction problems. The chart doesn't always say addiction on it. So somebody might be shooting drugs and have an abscess that we drain, or they have a cough or cold or infection. And what I wanted to do was say, we can treat that immediate medical problem that brought you here, but I'd like you to think about getting into an addiction treatment program. Because if you get somebody into a program today, it's not going to necessarily turn them into a sober citizen tomorrow, but at least the harm that they're causing on the rest of society would decrease. And all I could do is give them a sheet of paper with a bunch of phone numbers on it. And that was really inadequate. Many of these people have been in and out of prison. For many of these people, this has been a generational problem. And I also did my sort of regular 3-question market survey. How much do the drugs cost? So it's $25 to $100 a day. What do you do to get the money? Sell drugs, prostitution, petty theft, not so petty theft, major theft, crime of all types, and some part-time jobs, some semi-legitimate income. And would you go into a treatment program today if it was available? And the answer would be yes, but I couldn't offer any of those things. But if you take that are about 20+ thousand hardcore addicts in Baltimore City, not to mention 30, 40 other thousand that use drugs, but hardcore. And that's just in the city, times 25, times $50 a day, which is an average drug cost, times 365 days a year, which is a daily need. Then that comes out to almost $400 million. Wow. So just do the math. And when you look at it from that perspective, you say, all this money being spent to buy illegal drugs, and then all the social consequences and health consequences beyond that, there's got to be a better way, and you can recoup some of that money and use it then for better social policies.
In thinking, moving from the work that you've done as a clinician and thinking about how the drug policy interacts with that, how have you been able to translate the work you've done there into the legislature to really address the issues of drug violence and drug addiction?
With some success, not enough. One of the first major bills I did pass back in the 1990s was to increase funding for drug treatment, and it did have the effect of shifting the focus from only incarceration to at least incarceration and drug treatment. The issue, although I and many other people, many other legislators and the public have been involved, certainly a lot, I've played my role, but so have many others. It just was really difficult to get going. But in the last year, a number of things have changed. We've passed medical cannabis legislation with overwhelming bipartisan support. and signed by Republican and Democratic governors. The heroin overdose issue, which has really been present in the city for a long time, is now spread to the suburban areas, and so it's gotten gotten new attention. And so now people are looking at this differently. And so I hope that this is an open moment where a change in policy, and that's part of what this meeting is about, is to really drill down to policy changes that we can really make, shift the war on drugs from the destructive way that it's been to shifting into a recovery from it and a support for people and communities. And I think there's ways to do that now.
Mm-hmm. So, in thinking about what those ways might be, and having you had come in and really convene the harm reduction conference, what do you hope to see come out of the harm reduction conference? What would be a win for you with having convened the NGOs and the academics and the policymakers?
I think there's several potential wins for everybody, but from my lens through as a legislator, when you throw out concepts like harm reduction, to pass legislation, you have to drill down to specific language in specific bills. It's not just concepts. I mean, everybody's for harm reduction. That's easy. Everybody's for good schools and safe streets. But then what do you actually do? So the conference is broken down into work groups, and I can't name them all, but some are like called decriminalization and reentry and other kinds of treatment programs of various types. And so policing. And so the question is, how do you drill down specifically? For example, if you were to talk about decriminalization, that's a broad concept. For some people it's scary, for some it's a very logical path. But what does that really mean? Does that mean if you're arrested with a small amount of drugs, you don't have any penalty, or you can't even be arrested? Does it mean you get arrested and just get a citation? Does it mean that you have a regulatory system instead that takes over, as we have for alcohol and tobacco, dangerous drugs, but we have a regulated system, so the crimes related to the obtaining of it are really not there. There's some, to be sure. There are problems of both. Should we have a program where heroin addicts could come in to safe injection sites, safe injection locations, and be provided, if they don't have heroin, with a safer version of heroin there are, and be able to inject there? I mean, that's a very radical concept. But how does that structure out in actual law? Who's going to run those? Is it a local health department? Is it a state facility? Would it be contracted to a private entity under a regulatory scheme? But the advantage is that the addict, instead of running around trying to get $50 to $100 a day, can come in and get drugs that might cost $1. They wouldn't have to commit all the crime. You'd also have the opportunity to talk to that addict at that point in a controlled environment and say, now what do we have to do to help you get your life back together so you don't have to engage in this terrible behavior? But they're engaging in it now. And so it's a way of reducing the harm, reducing the damage that they do to themselves and all the people around them. But to do that, you have to change the laws of Maryland. You can't keep them the same way. And hopefully we'll drill down to do that. The other thing that Hopkins brings to the table is whatever actions may be selected here and whatever might pass through the General Assembly, the Hopkins research talent and genius that is here, we'll be able to monitor it and study it. So we'll keep track. We may have some very good ideas. They may not turn out to be so good, or maybe they need adjustment. We'll be able to do that also through the programs here.
You mentioned that for a lot of people, decriminalization can be a scary concept, or it can be a very logical concept, and that really points to the really deep controversy that surrounds drug policy and addiction issues, both culturally and politically. What do you think needs to be done in order to make meaningful progress in these areas in Maryland?
I think if we come up with sound ideas, it'll be taking it to the public first. The public actually controls the legislature more than the other way around. And we've seen changes in that in many other issues that we don't even consider controversial. I've been in the legislature 21 years. I've seen political battles about requiring seatbelts to be worn, or don't text while driving, or smoking in public places. Those are not even controversial issues anymore, but they were hard fought at the time, let alone things that are more high profile like marriage equality. So, and then the voters, before the marriage equality, people were against it. After the bill passed and they got a chance to study it and think about it, there was a referendum, and it was sustained. So I think these are the cycle of things that I've seen is sometimes ideas seem really far out and scary, but when people get a chance to study them and listen to the facts, and it'll be our challenge to present those facts and that information in a positive and enlightened way and show that there's a better way to get this done, I think the public will come around, the legislators will too. That may take a few years, but it's clear that what we've been doing for the last 50 to 70 years is not working. Rates of addiction are not down, rates of imprisonment are up, disease spread, social consequences of all types, not only the addicted population, but all the people around. I mean, where do addicts get the money? They take it from the legitimate society, the rest of us that are law-abiding citizens. We're also suffering the consequences of this. We also suffer in our taxes because healthcare costs that addicts spend. Every time I read in the newspaper there was a shooting and a person was taken to a trauma center, and I work in a trauma center, so I see the patients come in, and I can see how quickly we're spending $10, $20, $50,000 to take care of that person. Wouldn't it be better if there wasn't a drug trade, they weren't shot, and we as the rest of the taxpaying community didn't have to pay that money? Of course, we should take care of them, but the underlying problem is what needs to be addressed.
Fantastic. Dan, thank you so much for
Thank you,
talking
Adam.
to us today.
Take care.